Now, here's the thing. We're going to do some Mercury training here because Chris runs the company, and he tries to keep me from running it in the ground. But I'm going to help not only the company but the entire country right now. We're going to do, because I am a doctor, I'm trained to do this. We can now share with America the safety tips on how to just take care of some of those things that you routinely have done at surgery centers there at your office. So we've set up a little surgery room. Do you have your gloves? Where are your gloves?
Well, you're training. You didn't tell us to get gloves.
Well, yeah, I don't. Gloves. You're wearing coats. You're wearing white coats.
Well, you said to get the coats. You didn't say to get the gloves.
We're all scrubbed in, but I wasn't.
Sanitized.
You know what? That's that thing is. That's, you know what that is.
What is that?
That's doctors trying to make more money. You don't need to scrub in.
Oh, okay.
Okay.
All right.
Really? Because I thought that was.
No, you wear gloves. You wear gloves.
I'm pretty sure
you wash the gloves. You wash the gloves after every procedure.
You're fine.
You're good.
Okay.
You're
Glenn,
good.
What if I only have one glove? Oh, now I have two.
Yeah, you have two.
All right.
Yeah.
I was going to be like the Michael Jackson doctor.
No, the one glove actually is for the handy-capable doctors that we might have.
Okay.
We want to make sure we're not discriminating.
Glenn, that is pretty sure that they discovered the concept of infectious disease based on the fact that they did wash up every time in between surgeries.
Who's doing that?
What's that?
Who did that?
Doctors did that.
Doctors did that. Where did doctors work?
Hospitals. Like hospitals and
Hospitals. What do they use to scrub up?
Soap.
Who makes soap?
Companies.
Big corporations. Thank you. Let's move on. All right. Now, here's what I have.
Yeah, we're walking over here to.
We were walking over to. Thought we were on the air, but we weren't physically on the air.
Do you have us yet?
I'll walk over here. And are you hearing me now, Sarah? Okay, I'm on now.
Now we're on.
Glenn, you hearing Glenn?
Can you hear me, Sarah?
Okay,
good.
We're walking over to the
So
other
we're
side
walking
of the
over
room.
here. Now, look, this is not. You want to hold this?
Sure.
There are many.
The chainsaw?
Yeah, there. No,
it's not a chainsaw.
It's not. It looks like
it is a
stew.
It's a surgical accelerator.
Oh, okay, it looks like a chainsaw to me.
It's not. Okay.
But I'm not a doctor.
You're not a doctor. Now I'm going to start with the basics. Okay. I've already cut.
Now, why is the patient? Oh, you've already cut into the patient.
Yeah, I've
That's
already
why
cut
it's
into the
bleeding
patient because I
already.
wanted to show. What we have here is a mannequin on the set, and I want to show you. We'll give you some basic medicine here, and if you will, you can. First of all, your basic procedure. You have the knife.
Okay.
If you're going to cut into somebody, you have to use the knife.
That looks like a kitchen knife.
What's the difference?
And again, this is all because we're going to be doing our own medicine soon because doctors are going to be out of business.
Right. Yeah, well, that's definitely happening. So
this is you can scoop some stuff out.
That seems to be a strainer spoon.
And this, of course, is the forceps.
Those are tongs for like salad,
like barbecue. But it's all good. It's all good. We've washed them. Okay. So now what you do is you can reach into the chest cavity.
Yeah,
if you will.
Where there's
a little lower than the chest,
hole.
but it's kind of a.
Well, why would we? What are we reaching in? What surgical procedure are we doing?
We're just learning right now. This is exploratory surgery. It's going to make a comeback. It was big when I was a kid. You remember exploratory?
I do remember exploratory surgery.
It's going to make a comeback. It's going to be big. So let's say your patient has a cough, and they're like, "Where's it? Put your hands on your stomach."
Yeah. Okay.
Okay. Where are you feeling that cough?
Yeah, right in the middle there. Yeah.
A lot of people think. Now remember, I'm a doctor. A lot of people think that's coming from maybe there's something in your throat or your lungs. But if you feel it right here in your gut, don't you?
It's in your stomach. Yeah, you're right.
It's in your stomach. So you open them up, and let's look into the stomach and see where that cough may be coming from.
Just to confirm, you're saying because Obamacare is coming into effect, we're not going to have enough doctors, so you're going to have to do surgery yourself. And the first step in surgery is if they're coughing, you open up the chest to see what's going on inside.
Exploratory surgery.
Got it. Okay.
Okay. So now let's see how many parts.
Was this patient coughing?
No, this patient wasn't coughing.
All right.
Okay, you've cut the stomach open anyway?
Yeah, well, it does. It's a complex. It's a doctor thing.
Okay.
I know. Okay. So anyway, you go ahead in here, and I want to see now how many of the body parts. I want to see if you can identify what everything really is. Okay.
Right.
And
so just dig in.
Well, yeah, you can reach in now into and you dig in and see what you have.
Is that the? That would be the intestine.
That is the intestine. Yeah.
Okay.
That's the intestine.
All
yeah,
right.
you put that down.
Looks yummy.
Yeah. No, it's not yummy. You don't
No?
eat. No, you don't eat
Do we have a
it.
tray, Natasha, to
it.
potentially...
Nurse?
Yes. Okay, here we
Yes.
go.
Do we have a
the
tray? Thank you.
Now, why
Okay.
isn't
We
the
need a
nurse
medical
wearing
tray.
gloves?
The nurse isn't going to...
The nurse doesn't seem to be clean. She hasn't washed her hands.
That's okay. It's okay.
all right.
She had gloves
just,
earlier. She's going to wash the gloves.
Okay, I got some. Oh wow, I got something in here that's a little soft.
That might be...
Okay, I don't. What is that?
That's the-
Oh wow, that's really.
placenta.
Okay.
Placenta.
Wait, this is a
this
male.
patient is pregnant?
No, everybody has a little placenta in them.
Really?
Yeah. A lot of people don't know that, but a lot of people have a little placenta in them.
Because I thought
right.
women had that with the
No,
whole pregnancy.
not a lot of people know this, but the placenta is in all people, and lobsters as well.
Okay.
And it's the
People and
stuff
lobsters
at
are
the
the only
top
two?
of the it's the stuff that you crack open a lobster and it's
I
up
guess
there.
that's more.
That's more placenta.
there.
And
Hold
what's
on.
good in some countries, for instance, Italy is known for that. They make that into a nice little bread.
Oh.
And or bread, or it's kind of like a.
I don't
They
know.
pronounce
I'm
it
not a doctor.
differently.
I'm not a doctor.
Yeah, they pronounce it a little
Okay,
differently.
hold on. I've got something else here. This is a.
Yes, good.
What
You're
is
close.
this?
Come on, you figured it out. What is it? It's
it
a
looks
part,
like
it's a part of the heart.
It's like a drumstick.
But wait, it has a bone in it. How can it be part of the heart?
Part of the heart. Got a bone in it.
Drumstick.
Go ahead. You're there.
The
because-
drumstick?
Because the heart, when it beats, it needs a drum to make it beat.
Exactly right. So you
okay.
got it. Okay.
Okay.
So do you see
right.
any? Do you see anything that might cause a cough in there?
Well, okay, the rest of the intestine was maybe in the wrong place. Could that cause some coughing
cause that?
spasms?
No. No.
Okay.
No.
Hold on, let me
You
look
see
at
anything
it
in there?
deeper. Hold on.
So it's
Should I
not
go
that.
deeper? Because I see a lot
You
of
can go deeper.
placenta. Oh, here we go. Here's something else. This is something new.
Yeah.
Oh, look at that.
Oh,
Ooh,
yeah.
that's the liver. That should stay back in.
liver.
Oh, my God.
Yeah, that should stay in there.
You can't live without the
Okay,
liver.
can't live without the liver.
That's why they call it live.
Now, what did you learn from this?
It's really gooey inside the human body.
Yes, good doctor. Good. All right. Next.
It's warm and soft.
And
Looks like it could be delicious under the right circumstances.
we've learned also. You notice how I didn't administer any anesthesia yet.
No, that's.
Oh, my gosh.
Okay.
Should we have done that before?
Yes, we should have.
Okay.
But we've learned something because we have had our hands inside his guts looking for cough
Yeah.
Yes.
devices. Okay.
Yeah.
Because we've looked for the cough devices and we've found nothing inside, but we've cut him up and we've all had our hands inside of him and he hasn't moved. He has a sugar deficiency.
Oh, boy.
Sure.
Okay,
Why?
because he's lethargic.
Does
Oh,
that
yeah,
mean
you're right. I can
Good.
see the
Diabetes?
I do see the lethargy.
Thank you.
diabetes?
Diabetes diagnosis right here. Diabetes.
Thank you.
Doctor, what do you do?
Oh, well, I think you have to amputate his feet.
Yes, it's exactly what you do. If we just pull that back, we'll just
I mean, you could treat it, let's say, with other methods, drugs, but you'll make more.
well, why don't we
doing
just
this,
drill holes in
right?
people's heads?
Exactly right.
Well,
Why
wait,
don't we
wait.
just-
How much money will you make by cutting
Much
off?
more.
Much more. Okay.
There you go. There we go. Okay. Now,
There you go.
have you noticed?
All right.
Have you noticed? The patient has not changed.
Yeah, he's
True.
fine. He seems fine.
Right. Tonsils.
Oh,
He may have
yeah,
tonsillitis
tonsils.
as
That's
well.
a good point.
Now, there's two ways to do this.
All right.
Okay.
One, you could cut a hole, probably right about here, right?
Don't be mad.
Maybe
Don't be mad.
here.
Don't be mad. Don't be mad. Don't be mad.
Silly.
You notice he hasn't closed his eyes.
No, they're still open. They've been
Yeah.
open the whole time.
Okay. He's got a problem. He's got a problem. He's got a serious eye problem. I'm not only a doctor, but I also have serious eye problems. So, laser surgery is not going to be affordable anymore.
Okay.
So,
Wait, do you need your stethoscope for this?
what?
Do you need your stethoscope for this?
Yeah, you listen to the top of his head.
Okay.
Okay. If he starts to scream, tell me and I'll stop.
Okay.
Okay.
He's okay. He's okay so far.
Hold on just a second. We should be wearing eye protection to be
Oh,
able to take his.
that's
Thank
true.
you.
Here you go. Do you need
Thank
this?
you.
Oh,
no,
you
I
have,
got
you have
glasses on. Go ahead. You
me
should be
just,
wearing eye protection for this. This is otherwise I'm going to have to.
I'll just back
Well,
up
if
a
you
little
just
bit.
want to, if you just don't want to wear eye protection, you don't have to wear eye protection. 'Cause
No, I'm okay. I'll use the eye protection because I don't want to. I don't want to.
I am a doctor.
Yeah, because medicine's expensive, so I don't want
here
you
we
to.
go. Here we
Okay.
go. Now, if great thing is,
Oh my God.
now the great thing is, I've entered one eye, but I got to get both in.
Okay.
The great thing is, he won't have headaches anymore.
Right, okay.
Because this relieves the pressure of headache. Now, so you drill the eyes. Okay.
Yep.
Now you have a straight shot into the human body.
Right.
If you have one of those
Oh,
little,
yeah.
yeah, you can
Brilliant.
you can take one of those little things. I don't have one, but you're gonna have to find something.
What?
Either a little mirror and a flashlight through this eye, and then a mirror into this eye, and so you could look down all the way into the human body, and you can see what's apparently trapped in.
Well,
its
this
throat.
knife is shiny. You could probably get a reflection off of.
Might be able to do that. The other way to treat this, of course.
Oh, we never put these on. Were we supposed to put on the?
No, don't worry
Okay,
about it.
good.
Is if you really want to see.
I mean, I'm not I'm not a doctor, but it
No,
seems
we're
like
going
if you use that.
for the tonsils.
Yeah,
For the tonsils. Now I didn't cut the head completely off.
Yeah, you don't want to go too far.
You just go right here, and now you'll be able to get the.
Now,
Look at the tonsils.
now you can get right at the
The
tonsils.
tonsils are right down. Right here. Here are your tonsils.
Oh, all
Oh
right.
my gosh!
here.
Wow.
There they are.
And
Wait,
you
that
notice,
looks just like the
Have you
placenta
noticed?
from before.
They're very similar.
They are.
But don't eat this with Italian food.
Okay.
Okay.
Thank you.
You'll notice, listen carefully,
Good safety tip.
Okay. Shh.
the patient is no longer coughing.
Oh my
Good
gosh,
point.
you're right. Look.
Thank you.
Good point.
Okay, so you'll be able to perform this soon with all of your children.
All right.
And welcome to Mercury, doctor.
Thank you. Happy to be here.
You're welcome.
And thanks to that ruling yesterday, we'll all be able to practice this kind of medicine very, very shortly.
No, that's covered under Obamacare. That surgery, correct?
No,
Okay.
I am going to have to tax both of you for teaching you this. But the good news is we do have members of Congress now saying that we need to unionize doctors. So soon you'll be able to be in a doctor's union because you're now overqualified for what kind of medicine we're all going to be getting.